Good afternoon, ladies and gentlemen. My name is Bongo Adi of the Lagos Business School, and it is my distinct pleasure and honor to welcome you to this webinar today. This promises to be a great one, speaking to the issue at hand at the moment, which is our health. So today's webinar's theme is managing healthcare business during the pandemic and beyond. And it is Polaris Bank that is bringing us this very insightful webinar. So I have with me today a distinguished panel of presenters from the bank and from the health and Medicare space, who will be giving us insights on how we can deal with this, not how we deal with the pandemic, but how the business of healthcare can survive beyond. Of course, we don't need any reminding that the most important thing in our life is our health. But unfortunately, it's only when we are sick that we go to see the doctor, as usual. But today in the world, we know that health is the most important business. Because our lives, our health is threatened, everything has come to a standstill. Our life seems to have been suspended. Society as we know it has been disrupted simply because our health has been threatened. So there is no more important business than that of healthcare. And that is what we're here to discuss. So to lead us on that, we have, like I said, a distinguished team of panelists. The first is the MD of Polaris Bank Limited, a bank that is relatively recent, about 2 years old. But when it comes to its experience and the impact in the healthcare and social infrastructure space, I don't think that there are many to compare with it in Nigeria. And then it's led by a man whose career and experience bestrides both the private and the public sector. He's been to many places. He was the Commissioner for Finance in Lagos State, and he's a distinguished banker with so many years experience, more than 26 years experience. And I'm talking about no one other than Mr. Tokunbo Abiru, who is now the MD and CEO of Polaris Bank Limited. So like I said, the impact of Polaris Bank is being felt in the health sector. And I think that is the reason why they feel it is pertinent to bring this webinar to us today. Of course, we also have Dr. Abiodun Oyenoga, who is the Quality Assurance Advisor in Medical Credit Fund. Dr. Oyenoga will be speaking to us about healthcare business, how we can improve the quality of care, and strategies aimed at ensuring improved delivery of qualitative and sustainable healthcare services. We also have Mr. Adil Sheikh. Mr. Adil is the CTO, Chief Technology Officer of Mikio Group of Companies. He's responsible for process innovation, product development, and efficient running of IT operations. He'll be speaking to us today about telemedicine possibilities, business challenges, and the role of financial institutions. And of course, we have the lady in our midst, Dr. Itunu Akinware. Dr. Itunu is the MD of Medbury Medical Services. She's the Managing Director of Medbury Medical Services, and she'll be sharing her experience managing a healthcare business in this period. She's the only lady in our midst, and we are happy and glad that she's here with us. And then of course, we have Mr. Moshola Yusuf, the Divisional Head of Medical and Tech, Hygia HMO. And then the last but not the least, we have Mr. Shegun Okweko, who is the Directorate Head, Lagos Business. He will be sharing his experience on Polaris Bank's health sector product offerings. So without much ado, may I invite Mr. Tokunbo Abiru to open the session and give us his insights on the gaps and opportunities in the health sector business in Nigeria.
All right, thank you very much, Dr. Bongo. And I also use this opportunity to welcome all the members of the panel and all the participants that we have this afternoon. What I'm meant to look at under the conversation, that is managing healthcare and business during the COVID and during this COVID pandemic, has to do with the gaps and opportunities in the health sector in Nigeria. Now, as we all know that the current state of medical services the world over, as we see today and we know it, is overstretched, even including the developed countries. Because nobody anticipated the kind of current pandemic that we are going through now. But if by the time you situate it with the situation in Nigeria, of course, ours is even more peculiar because, again, we have what you can call preconditions even before the pandemic came about. So, so what are these preconditions? The preconditions that existed in our health sector space can essentially be identified in the areas of the inadequate health infrastructure that we currently have, the high rate of communicable diseases that we also have as a country, and also the rising non-communicable diseases. All these have led to very high infant and maternal mortality rate. And so today, the average life expectancy in Nigeria will be put at an average of about 52 years of age, which is not comparable to what is ideal, which is more like 65 plus. Then even our infant mortality rate at about 90 per 1,000, and even the availability of talent, doctors, we have almost 2,500 to 1, when what is desirable is almost like 600 to 1. So in all of this, what we see is that, over the years, we have seen inadequate or insufficient funding by the government, because, traditionally, everybody will expect that providing healthcare services should be that reserve of government. The insufficient funding over the years by successive governments in Nigeria. Today, we spend an average of about 4.6% of our budget on healthcare, when in other climes, what you find is within the range of 15 to 20%. Then, of course, riding on the back of that is also the low credit support, even from the banking sector as well. If you look at total aggregate credit in the sector today, you find that it's almost about 14.7 trillion. But while the financing in terms of health sector is just barely under 1%, i.e. about 47 billion. So the questions that we must be asking is, look, why is this happening? If we must develop the health sector, those are some of the conversation we should have this afternoon, and we should try and prefer solutions to. And what you also find that given this insufficient funding and inadequate infrastructure, what you find is that the health sector in Nigeria today relies strongly on out-of-pocket health payment system to finance the healthcare. That's why you see entrepreneurs trying to fund their healthcare on their own. Equally, you find even those who are meant to be the beneficiaries too, they have to fund it on their own. So, well, in all, I don't think it's all a story of gloom, because again, I think gradually, particularly in this country, we are beginning to see some semblance of improvement. The mortality rate is gradually improving from what it used to be. If you take, say, 20 years ago, which used to be like 1,000 per 100,000 people. Today, we have about 574. What is desirable is 70, but gradually we will get there if we can get the construct right as a nation. So what all this would suggest to us is that the health sector, it is essential to all and sundry, and regardless of your social status. And if we have a population that is estimated at about 200 million people, it clearly should tell us that, look, that the demand to drive the need exists. It's just for us to try and anchor and create, make the supply very efficient in a manner that can serve the larger population. So if there is anything we must try and take out of this, of the experience of the pandemic, is how do we, as a people, leverage the population that we have in order to make this essential service to all, a reality that can help us, improve our national development and create wealth for ourselves. So what are the opportunities that we see? I think the opportunities are not far-fetched, if you ask me. You have a population of about 200 million people, and the service that the health sector provides is essential to them. So clearly, the demand itself is right. So what we need to do is for government to play a pivotal and very frontal role in, and very bold in creating an environment, an environment for our health sector that will be beneficial to all. And part of what is expected to drive it is, yes, the demand exists, but we need to come up with, solutions or legislations that can help us, make the demand to be affordable. Because what is critical is for that demand to be affordable. Once it is affordable, I'm sure the supply side will gravitate towards providing all that is required. So what are the major things that I think government should do? One, I think that in the area of financing health or funding health, there must be very strong legislation around insurance. And that insurance must be well defined. It must be well defined, and there must be incentives that will also encourage it. So, take for example, we should be able to encourage people. Number one, the insurance should cover both the formal and informal. Today, yes, we have the HMOs trying to cover the formal sector, but we also need to create, value for the informal. So, like the drivers, the cooks, and all that. So we must have a legislation that should make that compulsory for those who employ such cadre of people, and we must also ensure that there are strict, penalties for non-adherence to such policies. So once we do this and we create a very strong awareness, I believe very strongly that even the healthcare system, the entire value chain of healthcare system will become very bankable. And I can tell you, knowing our entrepreneurs who ordinarily have the tendency of being capitalist in thinking, once they see that this in itself can finance itself, I'm sure it's something that they can create the enabling environment to support government initiative. Of course, government must clearly still be at the front burner, creating the creating further adequate facilities that will continue to support. And and part of the opportunities that I see also is that as we do this, and as we create this kind of value chain, there are other opportunities such as other industries that can come out of this. So beyond the traditional general hospitals, the clinics, and all of that, I believe strongly it will also help us grow our pharmaceutical industries, the logistic industries, and etc. And I also think that doing this again will help us, create a large employment pool. So a lot of our people that are out of employment, there will be jobs for them. There are those, the medical tourism that we are spending over $1 billion in a year would become something we can conserve in this country, such that our foreign reserves too will continue to improve. Those are the gaps, those are the opportunities that I see, and I think that providers of capital as well will see such opportunities and will always want to work around this kind of value creating opportunities. So on our part as Polaris as well, we remain very focused on small and medium scale enterprises, and we also support corporate entities with value chain opportunities. So as we are today, we are supporting we have specific products which my colleague, the divisional director of our Lagos business division will speak to. We have working capital facilities and structured loans that are also supporting the health sector. But I must confess, what we are doing right now cannot really scratch what is required. Equally, we are at the forefront of the central bank initiative in driving the opportunities to ramp up the facilities in the health sector. There is a 100 billion naira health sector intervention facility that has been put out there in the market today. It is a single-digit facility. It has a very long tenure of about 10 years, and I'm sure my colleague will speak more to that as well. Those are the things that are currently going on, and we believe strongly if we all, give it our commitment, I'm sure we can continue to, harness and improve the gaps and the challenges that we have in our health sector. So without taking too much of your time, because I'd like the specialists to still have their take on this particular subject. Thank you very much.
Thank you very much, Mr. Tokunbo Abiru, the MD CEO of Polaris Bank. We've been listening to him. So if you're just joining us, know that this is Polaris Bank webinar on managing the healthcare business during the pandemic and beyond. And we've just listened to the MD give us some insights, on the gaps and opportunities in the healthcare sector in Nigeria, the incentives that need to be created by the government in order to activate private sector investment to improve access and supply, and of course, quality healthcare in the system. Now, to take us further on our discussion, I would like to call on Dr. Abiodun Oyenoga. Dr. Abiodun is a quality assurance advisor of Medical Credit Fund. I think before he starts to talk, he would like to tell us what is Medical Credit Fund. He'll be speaking to us anyway on the overview of pandemic and its impact on the healthcare business. But before I bring him on, it is important to know that we have almost 1,000 people signed on to this from different parts of the world. So people keep fluctuating. I understand it could be because of the internet, but we are sure that we have the numbers. A lot of people are listening to us. So a lot of takeaways from this today will happen. So Dr. Abiodun, you will have just 10 minutes to give us the overview of the pandemic and the impact on the healthcare. But like I said, please let us know what your business is about in Medical Credit Fund. Thank you.
Good afternoon, everyone. My name is Abiodun Oyenoga. I work with the Medical Credit Fund, the business unit of the Farm Access Group. Farm Access as an organization is in the business of trying to strengthen the healthcare space, basically, across Africa. And if we understand why that is necessary, we'll see all the gaps that, like was mentioned by the speaker ahead of me. We have so many gaps in the health sector, and we've decided to take some sort of 360-degree overview and see how we can, attempt to step into the situation and see how we can bring things on board properly. So the Farm Access Group has three major business lines. We have the Medical Credit Fund that I work for, and what we do is to try to support healthcare businesses to access finance for investment, for healthcare investments. Right, great. So like I mentioned, we'll be talking about the overview of the health sector, and essentially, just some sort of quick run through. As we all know, the world was not ready for what we experienced earlier in the year. Although the pandemic, the viral outbreak had started late last year, but it caught a lot of us unaware because we all felt like it was a situation that was never going to come near us. But as at March 12, the WHO declared it a global pandemic, and witnessed a lot of policies worldwide, right? Majorly, the critical was being that international borders were shut. And individual countries also responded to this by instituting the lockdown, restriction of social gatherings, and of course, advising on social distancing, and all was in a bid to really decrease the mortality and the mobility from that pandemic. But of course, with the shutdown of businesses, with the shutdown of the movement, also meant that a lot of businesses had to shut down, right? With the shutdown of the businesses came with the resulting loss of income. And of course, with loss of income from the companies, a lot of people had to lose their jobs. So essentially, one of the things that we have seen so far is that this outbreak has kind of impacted a lot of people in different ways, but we'll be speaking majorly on how it has affected healthcare, right? So it has, we're going to look at two ends, the economic impact, of course, and then the lifestyle. So one of the major things that we found out was because it was an health risk, the shutdown, like I mentioned, there was some people had to start laying off because it couldn't sustain salaries. This ultimately will mean that most insured clients who necessarily patronize our healthcare businesses were not insured anymore. And so, of course, that means a loss of income for the healthcare facilities too. With the drop in economic performance due to the lower demand for oil, was also a decrease in the ability to afford care. So people would not be able to access healthcare the way we used to before, even though at that time it wasn't like it was fully optimal. And of course, with the restriction of movements, also means that global supply chains will be disrupted. A case in instance is the sudden situation we find ourselves with PPEs all over the world. At the point in time, everybody was struggling for nose masks and gloves and all of that. And it was because a lot of our imports were basically built around some of the channels that we had instituted. And of course, there was a financial market downturn, which means that we'll have inflation and then of course increase in the price of commodities. Now, with its impact on our lifestyle came with social distancing, having to work from home, increased use of technology. This necessarily means that most people are not able to go to the facilities, really, because, I mean, some of them, if you remember, I mean, for some of us who use HMOs, some of our facilities are not close to where we live. So usually we would have had to transport that. So this reduction in movement also would have meant that most people would not be able to access healthcare facilities. And of course, the healthcare facilities would also be overwhelmed, you know, because some of them would not necessarily not be able to have a lot of their staffs coming at the same time. And of course, because some people try to respond by trying to deploy technology, a lot of our patients were used to that face-to-face contact that we have with the doctors. And technology, the use of technology basically would not address their concerns as best as they would. So there's a lot of patient dissatisfaction. But what do we expect that healthcare businesses should do at this time, right? We expect that they should want to improve the safety of their patients and staff. And this, of course, becomes important because we are talking about an outbreak that is, we really don't know how, I mean, you know, contact, I mean, the smallest contact triggers some sort of infection. So we want to make sure that patients are managed in such a way that they are not sitting close to themselves in our waiting rooms, right? We create some sort of social distancing. For those of us who can, we should try and encourage them to wear nose masks when they come into the facility, wash their hands outside the facility. And then of course we can give them nose masks because we know not everybody will be able to afford that. You know, we need to improve our business models. One of the things that we found out in most healthcare businesses up until now is that a lot of our processes were not built on efficiency, right? And so this pandemic exposed a lot of the gaps in our processes, because basically we could not effectively carry out a lot of those processes. So this is an opportunity for us to improve on those processes, basically looking at how we can institute standard operating procedures to ensure that the things that we need to get done when due, right? We need to create a task force to manage change. There's a lot of changes that are going on in the business space for healthcare. The social distancing, for example, facilities need to know how to communicate to their clients. They need for them to, you know, put in that distance. They also need to communicate to their staff how to ensure that this...
Dr. Yanoga, you have 2 more minutes to speak, please.
Oh, all right, great. So I'll just rush through that. So we should also consider postponing non-essential appointments. Appointments that do not necessarily need for them to come in can be postponed. We need to start communicating adequately with the patients, ensuring that we are sending emails for those who can take emails. We can engage them via text messages. Also take advantage of telemedicine, right? So that we can consult for these patients without necessarily having to bring them into the hospitals. And then we can seize work from home opportunities too, meaning that we don't necessarily need to have all our staff coming to the hospital to work, right? What are the opportunities looking forward, right? We need to increase on the use of personal protective equipment. This was one of the things that increased the exposure of healthcare workers all over the world. You know, we also need to begin to look at deploying telemedicine in the use of in the course of our businesses. Then, of course, we're looking at more machine-operated procedures. This is also to ensure that we are not, you know, reducing contact with patients, right? The opportunities that we have following this, especially when we talk about the funding opportunities that was mentioned by Mr. Tokumbo, we're talking about opportunities into expansion into new business areas for healthcare providers, healthcare businesses. We're talking about capacity building and task shifting. There are some places where we can make one employee do more by basically building their capacity so that we can be more efficient in our healthcare delivery. Right. We also need to develop agile and resilient business models, meaning that these business models are such that they can respond quickly to such kind of disruption that we witnessed recently. And then with access to credit and financing, more financial institutions are looking forward to working with healthcare businesses. So the healthcare businesses can now begin to take charge of this opportunity and see how we can get more investments into that sector. And then of course, with the renewed focus on government reviving the healthcare industry, we can expect that more policies will be developed and will be coming up in the future to support this. The impact of this funding.
Dr. Oyenuga, please round up.
Right, yeah, last slide. Yeah, so the impact of this will necessarily mean that there'll be an improvement in the quality of healthcare that we're delivering to our clients when they're working, right? Essentially because, I mean, the quality of the equipment and infrastructure is something that we can now be sure of the results that we're giving them per time. And of course, with that impact and with that funding would mean that we can expand businesses, right? We can, for instance, where we were not doing, hospitals that didn't have laboratories could now begin to explore the opportunity. With this investment will mean that we'll have more patient satisfaction, right? And of course, with more patient satisfaction, increasingly patient satisfaction will mean that there's more profit for the businesses, right? Because the satisfied patient is the one that will come back, right? And also give word of mouth referral to other clients, and we can expect that would get a return on our investment. Thank you very much.
Okay, thank you very much, Dr. Oyenuga, for the insightful overview of the pandemic and the impact on the healthcare business and where there are the opportunities. So in order not to take a lot of your time, by the way, we are now, we've crossed the millennial mark. So about 1,013 people signed on from different parts of the world. So if you are joining us, this is the Polaris Bank webinar on managing healthcare business during the pandemic and beyond. And we've just finished listening to Dr. Oyenuga. And next is Adil Sheikh. Adil is the CTO of MICURE, and Adil is going to be speaking to us on telemedicine, possibilities, business challenges, and the role of financial institutions. He has just 7 minutes to cover what he has for us. I don't know if he has a slide to share, so we'll be happy to have him share the screen. Adil, please.
Thank you, Dr. Bongo. Let me just quickly bring up my slide. Okay. Good afternoon to everyone attending this webinar. My name is Adil Sheikh, and I'm the CTO for MICURE Healthcare. I'll be talking about a very, very interesting topic, which is telemedicine, the possibilities it presents, the challenges that businesses might encounter implementing it, and what role can financial institutions play in this regard. Now, in the last 12 to 15 months, MICURE has made significant investments in this area, and I hope to draw on all of my collective experience to make your time worthwhile on this webinar. So let's get started. Let me jump into the most obvious question first. What is telemedicine? The simplest answer to this question is a channel that allows remote delivery of healthcare services. So for example, instead of consulting with a physician in person, you could conduct a session with, over voice, which could be through a regular phone line or a video call. This could be through any software at all. Now, how does it work? A very typical use case and flow of events would be as follows. You would ideally pre-book an appointment at a specified time slot with a doctor. The doctor would then give you a call over a regular phone line or through other custom apps or software. All the more evolved consultations nowadays are usually done over video calls as they allow the physicians to check for visual symptoms and indicators to arrive at more accurate diagnosis. At the end of the consultation, the patient would generally receive a digital prescription and a summary of the diagnosis. Now, this prescription should also always carry an electronic signature of the physician so that it enables you to buy medicines from your local pharmacy. Now, so far, so good, right? Now, you might ask, now, how effective is it? So it's a very valid question. And in fact, from a consumer's perspective, it's the most important question. So over the years, various studies conducted worldwide indicate that, the efficacy of telemedicine does not differ drastically from a more conventional, in-person consultation with your doctor. Even for those cases that a physical examination is actually required, it is generally agreed that, a teleconsultation is a good first step, as it allows you avoids that unnecessary visit to the clinic. Now, all of that sounds great, right? Now, why is the adoption so low? Now, to solve this equation, we need to understand the dilemma of convention versus convenience. Now, convention says that only in-person consultations are effective. It is by convention or by habit that by default we step out of our homes, wait in long queues for our FaceTime with doctors. We feel safe. We feel that we are paid attention to. Now, there might not be any scientific evidence behind it, but it is a set mindset which is difficult to change. So the convenience and benefits of telemedicine may also sometimes be downplayed by healthcare institutions in the past. This could be because institutions sometimes fear change and might also fear loss of revenue and customers. Now, all of this is about to change. You might already feel it, and I will show you how quickly this might become the new normal. Now, what is renowned the world over as the COVID-19 pandemic also has a more interesting term in business circles. Investors globally call it as a black swan event. Now, these events are so rare and so severe that they force a tectonic shift in consumer behavior at a very exponential pace. In other words, it does not give you a choice, but it also provides you to make, it provides an opportunity to make long-term and favorable changes. Now, the charts that you see on your screen right now are from eMarketer, which is renowned globally for its insights and predictions based on a massive amount of data points. Now, in the first chart, you will see, it depicts the experience of US adults with telemedicine. Now, the timeline is very interesting because it correlates with the pandemic and reinforces how consumer behavior is changing rapidly. So the first chart here, if you see, in December 2019, 73% of respondents had never tried telemedicine at all. This percentage dropped sharply to 53% in just 3 months. Basically, now 1 in every 2 respondents would have tried telemedicine. That's a huge shift. Similarly, you would see very visible spike in respondents who have already tried or intend to try, depicted by the red and black lines in this chart. The second chart is interesting because it captures the comfort level of respondents about using telemedicine. Now, a whopping 64% of respondents think they are somewhat or very comfortable with this as a medium of healthcare delivery. Now, this number is going to grow definitely further. Now, yes, the last chart.
Great, but you have 2 minutes left.
Okay, fine. So I'll move on to my next slide then in that case. So if you're a healthcare institution today thinking of offering remote healthcare services for your consumers, here are the immediate challenges that you should be aware of. The first thing is, the very first thing you will absolutely need is a resilient and reliable tech infrastructure. Thankfully, cloud services such as Amazon are getting cheaper, and more importantly, they allow you to conduct your business in a secure manner. The next thing is educating users. Like I mentioned earlier, there is this mindset of convention that drives us to visit clinics in person. Another reason is the lack of general awareness of benefits for these services. Now, you might have the best interests of your consumers at heart, and you might invest in the most sophisticated technologies, but it might still fail if you do not pay attention to ground realities. What if your consumer has a patchy internet connection? This is where your infrastructure and processes need to be smart. You should be able to detect the best channels for providing healthcare services depending upon the demographic of your consumer. Now, a very great side effect of running teleconsultations is that you automatically capture electronic health records for your consumers. These are extremely valuable for a variety of purposes, ranging from, you could quickly accessing patient history as well as for analytics. It is paramount that you take necessary precautions to safeguard this data at all costs, because in the wrong hands, it could ruin your brand value and trust for consumers. I strongly recommend complying with HIPAA standards. These are guidelines issued by the US government in ensuring the security and patient information stored in a digital format. Now, the last and possibly the most critical challenge in providing a great experience to consumers remotely, this experience should be at least at par, if it not exceeds how you treat your customers at clinics. Now, collecting immediate feedback after a remote consultation is a great tool to improve your services in this regard. Okay, I'll quickly move on to an experiment that we ran for the last 12 months at MeCure. So we are offering 2 simple things. One is free teleconsultations with a small in-house panel of doctors, and the other thing was free sample collection for diagnostic tests. Now, quickly, since I don't have enough time, in the initial months, like 3-4 months, our call volumes were.
Please take your time. I'll give you extra 5 minutes.
Okay,
thank you.
Okay, so initially in the first 2 or 3 months, our call volumes were very, very low. Now, it didn't make sense to us because we were offering these teleconsultation services absolutely free of cost. There was no strings attached whatsoever. Now, our hypothesis was that consumers should rapidly adopt it since it was free anyway. So we tried various things. The most important of which was gathering feedback from consumers who did experience the service. The feedback was pretty great. They found the experience worthwhile and they did intend to try it again. Now, things gradually started to turn around. After 4-5 months, our call volume started increasing 150 to 200%, and we were doing about 40-45 consultations every day. Now, this is not like much in absolute numbers, but it gives you great insights into the mindset of consumers. The key learning from this case study is that a service like this will only work at scale if there is massive general awareness and especially a comparison of benefits against clinical visits in person. Okay. Now let's look at how financial institutions can step in to support this change. So there are really multiple ways in which you can do this. The first and possibly the most important, which I cannot reiterate enough, is to create awareness. Now, financial institutions such as banks have these built-in marketing channels to reach out to millions of consumers. Now, like I said earlier, any technology has to fight a preset and rigid mindset. The first step is to educate the consumer, talk about benefits and the efficacy of these solutions. If we hit the messaging frequently enough, consumers become more open-minded and accept it as a mainstream solution. So I strongly recommend if banks could step in, could use their channels at their disposal to run awareness campaigns like what we are doing right now for the legitimacy and benefits of telemedicine. The other thing is innovation on digital payments. Now, a very personal experience running the Meteor Smart Buy pilot was the frustration of failed online transactions from genuine consumers. Now, products like digital wallets, payment gateways, APIs that allow quick transactions definitely need more development. There is certainly some very positive progress in this regard. I see a good number of quality fintech startups in Nigeria trying to tackle this problem, and I'm certain that they will make things much easier in the years to come. The last thing here is tying up with healthcare institutions. So there are, again, multiple ways in which you can do this to move faster in this direction. For one, implementing telemedicine services in any meaningful manner does involve significant capital investments. Financial institutions can step in, and fund promising enterprises in this regard. While the opportunity presented for telemedicine has gained obvious importance in the ongoing pandemic, healthcare institutions might still be struggling with their cash flows in the near future. So it is the ideal time for financial institutions to step in, provide help, and I'm certain that they will be rewarded in the long term. So that's all, folks. I sincerely hope I was able to share meaningful insights in the time given. And I thank Polaris for the opportunity for inviting us to share our experience at Meteor. Over to you, Dr. Bongo.
Thank you very much, Adishek, for that enlightening presentation on telemedicine and how the financial institution can support the deployment of telemedicine. Of course, everybody got that, got interested in your presentation. A lot of people are asking questions about the slides and the recording. Yes, this is being recorded, and you will have the opportunity to view it. You'll also have the opportunity to get the slides as long as you are here with us. We are still above 1,000 people. We are doing very well, even with time. Our next speaker is Dr. Itunu Akinware, the only lady in our midst, the MD of Medical Services. And then she'll be sharing, her experience as a medical practitioner. Dr. Itunu.
Thank you very much, Dr. Bongo. It's a pleasure to be here this afternoon, and thank you to Polaris Bank for the opportunity, and for everybody who has tuned in, thank you as well. Before I go into my presentation, I must say that the health industry needs to come together now. There's a saying that goes, you shouldn't let a good crisis go to waste. Now that we have a lot of light being shown on the health industry and we are able to see the gaps in infrastructure and processes and systems, this is the time for all of us to work together to ensure that we can improve healthcare in Nigeria. Without further ado, I'm going to share my slides, and let me see if you can, okay. I should be on now? Can you see my slides now? Okay.
Yeah.
Okay, fabulous. So I'm going to be talking very briefly about managing a healthcare business during the COVID-19 pandemic. We would be walking through an outline that just first of all introduces us, which gives some context to what a few things I'm going to say, speak a bit about the emerging issues because a lot of that has been brushed up, and then talk to you about the new strategy that we had to develop in our organization in response to the COVID-19 pandemic, and then touch on some of the key areas that involve maintaining your revenues, managing your costs, and ensuring cash flow and liquidity in this difficult time, as well as, and then talking about some of the opportunities that the pandemic brings about. At Medbury Medical Services, we've had the opportunity to provide, and the privilege to provide services to a number of corporate organizations across Nigeria, spanning various industries, from the oil and gas industry to construction, to food and beverages, to banking and finance. Basically, we provide an end-to-end service that ensures that, you know, corporate organizations are able to have a good workplace health policy. And because of that, we have a diversified service and product line, which includes medical fitness checks. We have clinics across Nigeria, our own clinics and partner clinics as well. We staff factory clinics and company clinics. We also provide medical supplies to those clinics as well and to corporate organizations. And we do a lot of medical advisory as well, where we help organizations with choosing the right HMOs, help them in putting the right policies in place. We've said a lot about the emerging issues that we all have had to grapple with as healthcare institutions. I'm not going to spend too much time talking about that, but there were some key things. First of all, for us in our industry or in our own space in healthcare, we realized that a lot of the corporate organizations that we work for were going through different changes. Globally, this is what is happening. Some have had to cut back on hiring, some have had to fire some people or let them go, or, you know, so there's been a lot of changes even in budgetary allocations to healthcare. And we realized that that was going to affect some of the things that we had already put in place. And needless to say, there's been a very unstable supply chain system globally that has increased cost of PPEs, increased cost of even the basic things that we need in providing healthcare. But one of the things that really stands out is the fact that this put to naught a lot of our previous strategic plans, and we had to, in summary, pack that. We had to suspend that, and we had to hit the reset button. We had to go back to the drawing board and say, what did we need to do, or what did we need to change as a business to be able to rise up to the challenges that the COVID-19 pandemic had brought about for us. Now, and that drove us to coming to or developing a strategy. Now, I will advise every healthcare organization, if you do have strategic sessions and you haven't had one, this is the time to think through what you need to do right now. And for us, we came up with a three-pronged strategic plan. And the first was to maintain our performance despite the COVID-19 pandemic. Despite the challenges that it was going to throw, we were going to adjust our business to ensure that our performance targets were going to be maintained. The second was to make the most of our time and resources. And I'll give an example here. I remember the first time that Lagos was on lockdown and Port Harcourt was on lockdown, we decided as an organization that we were going to make the most of it, even though we were not operating as we should. There were things that we had to do as a business. So for example, our ISO certification had been pending. So we had to go through all our SOPs. We set deliverables for every department from HR to accounting. So a lot of things that we hadn't been able to do because of the day-to-day operational work, we were able to do that during that lockdown period, right? And then also provide support to our clients. And even before the pandemic came into Nigeria, we were already sending out daily reports, global reports, and just providing support in a time where there was a lot of uncertainty. I'm going to focus a lot on the first rung, which is what we call our Thrive Triad, which is how we are maintaining performance. And the first one is revenue, second is cost and cash. This very simple triad, these are the things that we believe that we needed to focus on to ensure that we maintained our performance. And in revenue, how do you increase or maintain your revenue? In terms of cost, how do you reduce or realign your costs? And then in terms of cash, I'm sure you've all heard that cash is king. How do you manage your cash and your liquidity to ensure that you don't go bankrupt? So I will start with the first strategy research prong, which is increase or maintain revenue targets. And to do this, the first thing we did was to carry out risk assessments, and we asked a few questions. And the first question was, how would the needs of our patients and clients change? And I think that this is the most important part of this presentation. If you are in business, you are in business to serve your clients. You are in business to create value. And because of the number of changes that have occurred, a lot of things have also occurred on the side of your clients. You must be close to your clients and understand what they need at this point in time. So we asked those questions and we realized that, okay, our clients needed a lot of more advisory. Our clients were scared about how their businesses would survive in light of COVID. Now, the second question was, how will our products and services be affected? And I had spoken a bit about our diversified service portfolio, and we realized very quickly that some services would have to take a downturn. So for example, we all, those that have healthcare clinics or facilities would have inadvertently now experienced a reduction in footfall. But you now find that in other areas of our business, such as medical supplies, the requests for medical supplies had gone up. So we had to understand how our business would be affected. Then how will our resources be affected? Because we would have to reallocate our resources, and how will our operations change? Those are questions we need to ask. And that is the question, these are questions that we all need to ask in our businesses today. So what were the interventions and what were the things we did? The first thing we did was that we realized that we had to take out or downsize some certain services. And I'll give an example. We have clinics, and because of the downturn in the footfall of those clinics, we realized that we had to move resources from those clinics to other areas of our business that seem to be doing well or seem to be doing better. So we understood that very quickly. So I'll give a clear example. If you are running a clinic and you are having a footfall of, say, maybe 50 to 100 patients a day, and now you have just about 20 patients, why do you need to have the same number of staff? Why do you need to have 3 cleaners, for example? Let's get practical. Why do you need to have your diesel running for 24 hours? Is there a way in which you can manage your operations just to downsize in that part of your business? Now we also realized that we needed to build new products and services. Now, I mentioned something about the fact that you must be very close to your clients at this point to understand what it is that they need. And when we interacted with our clients, we understood that they needed to, how many minutes do I have?
Yeah, Dr. Akinwere, much as people are enjoying your presentation, but
how many minutes do I have? Oh my God.
3 more minutes.
How many?
Yes.
3 more minutes. Oh, wow. Okay, so we had to build new products and services. An example of that is we built a mid-advisory product where we were able to help our clients to get through in terms of business continuity planning. Now, I'll move on to reducing and realigning our costs. And I'll say realigning because I'd mentioned that some parts of our business weren't doing too well, while other parts were receiving some more interest, so to speak, and more footfall and more business. So because of that, we needed to reallocate costs. So I give an example. So clearly there was, in some of our clinics, we split the staff into half and moved half of those staff in one clinic to another business unit. And we had to train them and get them to provide services in that business unit. I will say something here that after COVID, if there is ever such a time, there are some things that you are never going to need anymore. You need to know what those things are. You need to rationalize and cut them out immediately. If you need some staff now, or you need some resources now, you don't need some resources now, excuse me, and you're still going to need them in future, you reallocate them so that by the time there's some normalcy, you can bring them back. And the fourth prong, and maybe one of the most important, is that cutting does not mean no spending. You just need to ensure that you are spending on what can generate for you and identify what you want to invest. Cash is king. Revenue is not cash. Because you've made money, and if you haven't collected that money, then there is a problem. So what are the things you need to do? Number one is you need to identify the cash you need. What are the things that can wait? What are the things that you need to do now? You must pay your salaries every month, but must you buy that staff bus today? You need to be able to optimize. Then receivables and credit control. You must aggressively manage this. Now, a lot of organizations are trying, in business continuity planning, are trying to hold their cash as much as possible. So you must have a good credit control system where you are not just offering service and nobody's paying you. You must speak to your clients about this. Do you have loans and liabilities? You must restructure them. Banks like Polaris and other great banks out there have actually taken the step to help businesses to restructure their loans and their overdrafts, and then you must negotiate with your suppliers. Finally, as I said, while COVID-19 has brought about a lot of challenges, it also brings about opportunities. And just looking at the different opportunities, there are more opportunities for medical equipment and PPEs. We've seen that. We've heard about telemedicine, and it's not just telemedicine in terms of teleconsultation. There's going to be a lot of wearables right now. So we have wearables that, you can wear a watch that checks your pulse and your blood pressure, is checking your ECG, and is reporting back to your doctor. Those are things you need to start thinking about. Manufacturing, I was really excited to hear that the RNA extraction kits that is used in PCR testing today for COVID is now being locally manufactured. You need to still start thinking through those areas and through those lines, and then also in diagnostics as well. My closing thoughts: the best time to have planted a tree was 20 years ago, and the next best time is today. If you haven't planned, if you haven't done a risk assessment, and if you haven't come around to have a strategy to survive now, this is the best time. Thank you very much for having me.
Thank you very much, Dr. Itunu Akinware, for that insightful presentation yet again. A lot of people enjoyed your presentation, the strategy, the trial that you mapped out there. So next, the questions are piling up. We will address all the questions, but I will also encourage the panelists to look at the questions. There are some that you will want to answer. Maybe you will need to type it to the person who asked the question directly. So that will help us to manage our time as well. Our next speaker is Mr. Omoshola Yusuf, the Divisional Head, Medical and Tech, HIGEA. HIGEA is HMO, and then he's going to be speaking to us on the opportunities in the healthcare sector from the HMO perspective. Mr. Please.
Thank you to Polaris Bank for organizing this. It's good that people come together and try to understand the new times very quickly. Okay, so I just have a one-page slide that will try to explain to everyone what we do what the HMO is, because a lot of people ask those questions, the relevance of the HMO and the opportunity, the main opportunity that we see out there during these times. So let me see if I can just share that slide very quickly. Generally, the times are peculiar times. We have new norms, and it's affected our lives. It has affected, the way we look at things. We are adopting things that were not very important yesterday are becoming very important today, and some things that were important yesterday are not so much as important anymore. The main issue for us as an HMO is that we try to understand what's going on from two sides at all points in time. We look at our client side, and we look at our suppliers. We are sandwiched in between. So the supply side and the client and the buy side is always important for us. So we always look at that from a strategic perspective and see how it has affected us. So on the supply side, what has happened is that we've seen, the cost of care has basically shot up. That's a direct consequence of the COVID era. They're having to invest in more consumables that are more expensive. So a pack of gloves that used to sell for 500 Naira, today is selling for 5,000 Naira. That's over 1,000% increase. And other consumables are more expensive these days. Drug cost has gone up. So the cost of care on the supply side has gone up, essentially. What that means for the entire chain from an HMO perspective is that the HMOs will most likely react by transferring that cost to the other side. which is the buy side. Now, you also need to think about the affordability on the buy side. That's the reason why they need HMOs in the first place. If the affordability is, if buying plans or health plans becomes less and less affordable, then the entire chain breaks. So the ripple effect of the COVID-19 is far-reaching in the sense that it had the potential to actually break the value chain. Value chain meaning that the client side, the buy side, right, might no longer derive or see value in the whole process, and it might begin to crumble. So, however, there are opportunities in there where that's what we have been trying to focus on as an HMO, on how to stabilize this value chain because it's at risk. And the one major opportunity is an opportunity to grow, bring more people into the nets. And let me explain that. In such a time, right? Remember that COVID is just one ailment, right? We still have needs, medical needs of other ailments, other critical illnesses, and all that. That is not going away in the first place. However, the cost of care is going up. People are losing their jobs. So how do we address all this so that we sustain the chain? The one opportunity for us to continue to sustain the chain is to bring more people into the net, because insurance works based on the principle of large numbers. So it's risk pooling. The more people you can bring into the pool, the better the pricing, or the better pricing that you can have in the market. So how do we get more people into the pool? We have looked at this as a major opportunity, and the way to do it right now is a major opportunity to drive awareness. The way to do it is through partnerships, and partnerships essentially with institutions that already have connections to the market, because one of the panelists had already said previously that while the HMO has practically covered the formal sector, but there's the large informal sector that has been largely uncovered. So bringing those people into the net increases the pool, which then allows for better pricing in the market. So imagine connecting with, I am partnering with a bank, a financial institution that already has between 500,000 to 4 million retail customers. Partnerships in the areas of product design, and in the area of distribution, right? It is through these partnerships that we're able to drive awareness and bring more people.
Mr. Yusuf, you have 2 minutes left.
This is the best time, this is the right time. Thank you. This is the right time, this is the best time to start to explore those opportunities. So financial institutions, right now, the HMOs are supposed to be your good friends. Partnerships could also be with affinity groups, religious homes. Think about it, anybody that has some kind of connection with the market, this is the best time to do this, to approach the HMOs. It's an opportunity to ensure that the entire chain remains stable, because that's our own goal right now, and nothing is broken with the chain as it is. Thank you.
Thank you very much, Mr. Yusuf. The insight from HMOs. So it's also good to hear from their own point of view. So last but not the least, we'll have Mr. Segun Okweke, who is the Directorate Head, Lagos Business. He'll be speaking to us on Polaris Bank health sector product offerings. I mean, a lot of questions are already coming on that. Somebody asked Mr. Roland Dangana, who is the CEO of Beloved Diana Specialist Hospital and Wellness Center. He asks, what is the role of Polaris Bank in assisting healthcare providers access the FGA, Federal Government Intervention Fund? How do healthcare providers access this intervention fund? Is it through the banks or through the CBN directly? What is the timeline for accessing the bank? So a lot of questions are around that, about access to funds, what will be the bank support. So Mr. Okweke is going to clear all of that for us now. So you have the floor. Mr. Okweke, please.
All right, thank you, Dr. Bongo, and good afternoon to everyone online. I was speaking specifically to Polaris Bank offerings to the health sector. It will be basically two-pronged. We have what is direct to Polaris, which is our own product offerings that we've had in the market I must say, pre-COVID, because we've also, from time, focused on the health sector, and we think it's an important sector of the economy that needs to be developed in terms of capacity and the infrastructure. So we have what is called the Polaris Health Sector Loan. Then there's also the other angle, which is the CBN 100 billion health sector support fund, which was recently introduced by the central bank after the advent of COVID, which is also set up as a proactive measure to cushion the impact of COVID, and also to help to develop our healthcare infrastructure system. So those are the two. So I'll start with the Polaris Health Sector Loan. And what is it about? We have two variants. One, we have what can be available as an overdraft, which is basically short time. It's a 180 days facility. Basically, working capital purposes, this is supposed to be used for things like purchase of consumables, discounting of invoices, salary payment. It's a working capital facility, basically, particularly for the health sector operatives. It's targeted at hospitals, pharmacies, medical laboratories, diagnostic centers, and all. Basically, just to support funding needs for doing the business on a day-to-day basis. We also have what we call the term loan. Term loans are available for tenors of up to 48 months. These are longer term facilities which are structured. They can be used for renovation, expansions, purchase of equipment for hospitals, acquisition of vehicles, depending on what the need is. But once they are long term and they are capital assets acquisition, then those are things that we can use it for. So basically, we have this interest rate, which I also know is a very sensitive thing that people want to know. For interest rates on Polaris Health Sector Loan, it's market driven, because basically these are monies we've taken from depositors. So these are monies that we need to give out in such a way that the bank is also comfortable enough to repay who would have given us the money. Maximum amount available under the Polaris Health Sector Loan is 50 million naira per institution at this point in time. And then the collateral requirements are flexible depending on the business, the assets they have, and what we think will make sense for us. We also are able to give dedicated relationship managers, and there's a team in the back that handles this. What that also does for the business is that they have access to our over 7 million customers that they can use to do cross-selling of their product or services. So that's basically what we have under the Polaris Bank Health Sector Fund. But then we come to the other one, which was the special intervention by the central bank, which all deposit money banks, of which Polaris is one, are able to participate. And for that also, what the central bank has done is made 100 billion available for development of to enhance what we have in the health sector. So it's available for manufacturer of healthcare products, drugs, medical equipment, service providers, hospitals, clinics, diagnostic centers, laboratories. It also covers fitness and wellness centers, rehabilitation centers, dialysis, blood banks, pharmaceuticals, people that distribute medical products and logistics, and other healthcare service providers as may be determined by the CBN from time to time. For each obligor under the CBN intervention fund, the maximum amount per obligor, which is the institution, is 2 billion for the term loan, and also 500 million for working capital. The working capital also pays attention to shorter tenors, but for the term loan, you can have that for a maximum of 10 years, but for the working capital, it's a maximum tenor of 1 year. The interest on this, like my MD mentioned when we started, is actually single digit. So the CBN has made this fund available for the first year, which will coincidentally end March 2021. Interest is at 5%, and then subsequent years, interest is pegged at 9% per annum. So basically, the purpose of the loan can be used for manufacturing, for drugs and equipment, establishment, expansion, of existing facilities, specialist healthcare facilities for distribution of pharmaceutical drugs and medical supplies, and for any other healthcare value chain activity as may be determined by the CBN. Yes, to access these funds, you need to come to the bank. We do our processing, and we've given a commitment that all loan processing at the end of the bank will take between a 5 to 10 working days maximum, whereafter we need to now forward that proposal to the CBN for their further processing, and then they disburse to the bank and the money is made available to the institution that is applying for that. So basically, those are the two-pronged products that we have. One, the bilateral between Polaris directly and the institution, and the other one, which is the one that we now leverage on the CBN Intervention Fund, the 100 billion that has been set aside to help build capacity in the healthcare sector. So basically, those are product offerings, and I'm available to answer questions. Thank you, Dr. Bongo.
All right, thank you very much, Mr. Okweke, for your, again, providing insights on what Polaris does to intermediate credit facilities for the healthcare industry. Two prongs, the bilateral between Polaris and the individual or the institution, approaching it for that, and then helping to assess the central bank. A lot of questions still on that, on how people without collateral could be supported or assisted to assess the CBN intervention, but I'll allow you, you come back to that in the closing moments. By the way, ladies and gentlemen, we're happy that you joined us here and you agree with me that it's been a very interesting session from our team of distinguished panelists who have thrown up a lot of insights on how to manage the healthcare business during this period and beyond. And we have learned quite a lot of things on telemedicine and strategies and all of that. Okay, a lot of questions have come up here. So we'll be taking them the much that we can so that we don't run out of time. We promise not to keep you beyond 90 minutes. I hope that is not too long for some people. Now, the questions, I'll be picking them and then throwing them to the members in the panel whom I think are in the better position to answer them. So there is the question from Mr. Victor Carlo. I don't know if you're still listening in. Mr. Victor asks, what innovations are we expecting from the HMO space to reduce the cost of individual health insurance adoption in Nigeria? And of course, there's no one better to answer this than Mr. Yusuf. He comes from the HMO, from Hygia. How are banks helping non-corporate individual customers, because it is extremely expensive to take up HMO policy? So Mr. Yusuf, I don't know if you are in position to address this question.
Yes, thank you very much. Okay, so I tried to answer that question in my previous presentation, but so let me say, first and foremost, the whole telemedicine conversation is one of the ways that the HMO would be, or that the HMOs are now partnering to drive down costs. Because, with primary care, you don't need physical examination all the time. I think it's been proven about 60% of consultations, primary care consultations, don't require real physical examination, especially when there are follow-ups. We've seen adoption. Initially we were scared, but this COVID era has made us realize that, look, these things actually work. We've seen gradual growth in the adoption of the telemedicine platforms and teleconsultation platforms. The introduction of that allows us to play around with the plan offerings and then come up with products, innovative products that essentially are not as expensive as what you would have gotten under the conventional plans. So we are partnering with a lot of companies like this, using technology, leveraging technology to deliver healthcare. And those are one of the ways that we're looking at. I've spoken about trying to grow the net also. I've said, look, it's a pool, it's a principle. Insurance generally we intermediate between affordability and demand aggregation. It's similar to what the banks do. We intermediate between surplus and deficits. We intermediate between the need for affordable healthcare and the demand aggregation required by the suppliers. So one way we can generally reduce costs across the chain, right, is to grow the pool, right, capture more people in the net. Now, the opportunities out there is that a lot of people are becoming more and more used to tech products. They're using their phones a lot, things that people are not normally doing, but they're now doing. They're using digital platforms, right? So this is the time, right, to drive the health insurance conversation across to those that don't have it. So we still have a huge population that is uncovered. And with that,
let me interject.
Yes.
I'm not interrupting you. There is another question somebody asked as a follow-on to what you're saying. That
right.
with costs, how do you de-risk and manage the expectations coming from the informal group in the pool, considering the unstable business environment is, so he's asking how do you manage that?
Okay, so from the informal, so first of all, we have to reach them first. If the average books of the HMO is the tilt is likely between 95 to 98% corporates. We have very retail that's supposed to account for the majority of the informal sector is very, very small. The problem first and foremost is that we've not reached them, right? They're not captured in the net, right? This, the artisans, the businessman at Alaba, most of them have no coverage. So the first things first is to reach them, right? If we partner with reputable companies like the banks, right, that they know, they trust, right, it reduces all so we'll partner with them. We come through, reach them through these banks, right, with joint products that we've jointly developed with the banks, financial institutions, right? Because they trust that bank, the institutions in front of them, which is the leverage that the HMO will use. It takes away all the risks that exists in terms of the entire chain. So okay. The opportunities are there, yes.
All right, thank you very much. Yeah, sorry, I will get back to you if need be, so that we have opportunity to look at some of the questions. Check, there's some people asking, what's the role for nurses in telemedicine?
The thing is, telemedicine can immediately address only, the first set of primary healthcare services, like, your consultations with doctors and so forth. But for any services that require, like, hospitalization or treatment at the clinic, or you have to stay there for X duration of time, that's not covered. That's not technically telemedicine, but yes, there are services like, dialysis can be performed at home also. There are providers, vendors across the world which do this on a regular basis throughout so many years. So you will see adoption for these services going forth. I think that's definitely going to be a strong trend.
Okay, great. All right. I think we're now wrapping up. I will go back to Mr. Abiru, the MD CEO of Polaris Bank. Some people have asked the question, what do you want them to take away from this webinar? What really went through your mind when you decided to launch this program, this webinar today? So what do you want people to go home with?
Yeah, once again, thank you very much, Dr. Bongo. And once again, I also will acknowledge my other panelists. I think everybody here has done a great job. Now, as I listen to everybody and I see, what I see is an opportunity for all of us as, people of this country. The opportunity that we shouldn't allow to slip away is the opportunity for us to actually leverage on the kind of, what I described earlier. The healthcare services, as we all know, it is what is essential to all and sundry. Whether you are a big man or a poor man or whatever, it is important. Now, the scale of your need might also differ, I agree. But again, the opportunity it presents for us is an opportunity that I think can help us as a nation create national wealth for this country. It's beyond, those who travel abroad to go and do one form of medical stuff or the other. Look, this is an industry that can help us address our employment problems. This is an industry that has linkages that can create wealth for all. So, I mean, whether it is telemedicine, we need to have a complete cycle. I listened to Dr. Itunu. I mean, she did gave a perfect account as to how businesses should be managed. People can learn, and I'm sure, even, I mean, without minding you, Dr. Bongo, I'm sure some of the courses that people will come for in LBS, she has more or less taken that session this afternoon. But you see, talking seriously, I think that, very critical to all of our gathering together here is that we also need, government to be in the forefront of this. We need policies that will support this cause. Motoshort spoke about insurance. You need insurance to, to back this. The insurance shouldn't be limited to just the people who can afford the loan. That's the organized private sector. We have got to think through the box as to how do we also help people who are outside of the organized sector. So we must bring everybody, because this is a service that is essential to everybody. So for the basic ailments that we see that Nigerians have, this is an opportunity to create, an ecosystem that can manage it, and it will create wealth for all of us. And that's the only time you can also find even the banks, the providers of capital and all of that. They will come, they will rally around this concept and also make sure that it works. But importantly, you also need government at all the tiers of leadership in the country, whether it's the federal, whether it's the state, whether it's the local, because you need them to lead by, policies that will support the cause of this sector. So for me, if there's anything we must take away, everything is that everybody here have said, very important, but we should not let this opportunity just slip away. So thank you. I mean, that would be my wrap-up.
Okay, thank you very much, Mr. Abiru. I don't know why I feel like calling you Dr. Abiru all the time. So, you've been to LBS, you've been to Harvard. We expect you to come back for your DBA. Anyway.
No problem. Thank you very much.
Okay, so distinguished panelists, ladies and gentlemen, you will agree with me that it's been very educative, very informative session. From my own, I'm a scholar, I'm an academic, so coming from that background, I know that something that is lacking is, healthcare programs, how to manage effectively healthcare. I know there's a program at Stanford University, our sister institution, the EDC, Enterprise Development Center, in partnership with Pharmaceuticals. I think they do a bit of a program for small operators in the healthcare sector. But when it comes to overall management and strategy, something like that is lacking. And we've been trying at LBS to develop something. So I can see, that's the synergies that we need, all of it here. Sheikh bringing the aspect of innovation in the healthcare industry. Of course, Polaris Bank is playing very strongly in the financing of healthcare. Financing the healthcare sector is also not easy. What is missing here is the public sector aspect. If you had got someone from the Ministry of Finance or Ministry of Health, I think that would have covered the entire scope. So, but nothing has been missed. I appreciate all of us, all the panelists, for the high impact presentation that you've made. All the attendees are requesting for your slides, and then a lot of people are still here with us. We started with about 600 people. We got to the height of 1,070 people. Now it's dropped to about 950. So I think that is telling us it is time to call it a day. Once again, thank you for joining us, and I hope you will come, when next we call on you. Thank you very much.